So welcome to what is the second of the Occupation Matters seminar series. The first one was by Brock Cook, who's sitting up in Townsville, and his was recorded, and that will be available on the web soon, and the plan is for this to be available. The point of these seminars is I'm just keen to engage with the local and not so local, given the number of people we've got dialing in, occupational therapy community, and to provide a bit of a forum where we can talk about some of the issues facing occupational therapy. Because of my interest and also because of the direction that I want the program here at the university to take, the key focus is of this seminar series is about occupation, but broadly interpreted. So we have another one coming up next month, and I'll send details around about that, from a private practitioner who does lots of coaching and has a web-based support service that she provides as well. We've got one coming up in a few months, which is about occupation in stroke rehab and neuro more broadly. So the plan is to have one a month for the teaching year, essentially. So there's a few coming up. If anybody has any ideas of people who'd be really good to speak, or you want to speak yourself, then please just let me know. But welcome to the second one. We are live tweeting these events as well. So Brock is going to do that for this one, as I can't do it. And again, those transcripts are available on the web afterwards. It is interesting. I know we probably have somebody following from New Zealand, and the last time we did one of these, we had some discussion from New Zealand and from Victoria when Brock was presenting. So just trying to build this community of people who are interested in some of these things. Okay, that's all the background stuff. Let's talk about occupation, which is the theme for this one. What I would like to do is, again, because of time, the whole point of these is to be fairly short and sharp and provide time for discussion. So my aim is to present some information about occupation and then really open it up for discussion in terms of what does this get you thinking about. So I'm not going to fill the whole hour. And so some of the stuff we'll go through a bit quickly, but please jump in and ask questions or save it to the end when we have some discussion. The point really is to get us all thinking and talking about some of these issues. And with some of the web-based stuff, the beauty is if you're on Twitter, you can go away and contribute to the discussion when you have another idea, because you can stick the hashtag in and we can all see that for those who are on Twitter. Okay, so yes, get onto Twitter. First of all then, why should we bother talking about occupation? And in some ways, this is a rhetorical question, but in some ways it isn't a rhetorical question either, because I think sometimes we forget about why is occupation so important, and there are lots of reasons why we sometimes forget about that, but I think we need to remind ourselves of it as often as possible. And without being facetious, it's because we are occupational therapists and we are practicing occupational therapy, if we're called occupational therapists in our jobs, of course. And so I think we owe it to ourselves, our clients, the people that we work with, that we are able to, that we understand the concept which is central to our profession, but also that we understand and are able to use that in practice with the people that we work with and for. And so that's why I think it's really important. In terms of what is occupational therapy, the World Federation is pretty clear, and this is just a snippet, that occupational therapy is a profession concerned with promoting health and well-being through occupation. And I think it's often worth thinking about those last two words, because I think this is where, and we'll probably come on to this towards the end, we can start to have discussions about this suggests we do it through occupation. And my interpretation of that is that we are engaging our clients, service users, patients in occupation, which raises some questions about those therapists and those practice areas in some ways that argue that we are aiming for someone to engage in occupation and that we will do other things in occupational therapy, but we won't necessarily engage them in an occupation. We'll do the preparatory, the underlying stuff, and that's okay because that's occupational therapy. Now, I have a view on that. We might come back to that, but I think it's worth thinking about some of those things in terms of what does it mean practice should look like. And I guess just to reinforce that, another part of their definition is that the primary goal of occupational therapy is to enable people to participate in the activities of daily life, or occupations as we call them. So what does that mean for us as occupational therapists? And one of the things that I think we don't think enough about, because in some ways it's a bit philosophical, But Gary Kielhofner, in his books, his conceptual foundation books, has always had a really good chapter about the history of the profession. And in that, he traces the stages the profession has gone through using some material from Thomas Kuhn, which you probably can't read because it's small, but he has looked at the structure of science over the years and uses this idea of the paradigm, and that the paradigm means that people who are part of that group, so in our case, occupational therapists, we have a particular paradigm, and that means we look at the world in a very particular way. Now, I think it's questionable whether or not we all are in the same paradigm, because I think sometimes OTs don't all view the world in the same way, and I think that's one of the issues that we face as a profession. So that's why I think it's useful to think about this idea of paradigm, because I think it draws into sharp contrast where some of the issues are. So if we go along with that idea, and I think it's legitimate, then we are currently in what has been called the contemporary paradigm. And so in terms of what that means for us, it means that if we are occupational therapists, and if we are all within that contemporary paradigm, then we view humans as having an occupational nature. And that's not just that it's nice to engage in occupations, it's that it's crucial, it's part of what makes us human, it's completely necessary, it impacts on health as a whole. It's not just that it's nice, it's innate. Secondly, that whenever we try and understand the challenges that the people we are working with or for face, then we view them as occupational problems or challenges. And so our first port of call shouldn't be, right, this person's got perceptual motor issues, they've got reduced strength, they're hearing voices, all those sorts of things. Our first conceptualization, if you like, of what their challenges are should be, what are the occupations they're having difficulty engaging in that they want to or need to. We can think about the other stuff, but the priority is the occupational challenges that person's facing. And so the third part of the occupational paradigm then is this idea that therefore what we do in practice is occupation-based. And again, we can have lots of debates about, does that mean you have to engage clients in occupation, as I touched on before with that definition? Or is it enough to say, I will do a whole range of things, the ultimate goal of which is to enable that person to participate in the occupations they want or need to? Is that enough? And there are varied views on that. But the idea is then that these are the things which are underpinning occupational therapy practice at the moment. And again, you can see occupation just keeps coming up, not surprisingly. So we are occupational therapists, so we need to really understand what occupation is. One of the things that I think we need to also recognise before we get into some nuts and bolts is that occupation is simultaneously very simple and very complex. And I think this is the blessing, but also the curse of the profession and of us within the profession when we try and talk about occupation. Because yes, it's true, and you'll see one of the definitions is it's essentially anything that people do, and that's fine. But my challenge would be if, as occupational therapists, that is the extent of our knowledge about occupation, then I think we're doing ourselves a disservice, our clients a disservice, because actually it's also very complex. And my argument is in current health and social care, with the ICF and lots of people talking about participation and activity, my view is that as occupational therapists, we are the only ones who understand the complexity of occupation, and others use that other terminology, which is actually really relevant and links in very nicely. But I don't know that all the other groups who are involved in that sort of space understand the real complexity of occupation. And so I think that's the niche for us, is I think we do, and if we don't, we should do. Okay. I'm not going to do the question that the second question I think that all occupational therapists read. The first one being, what is occupational therapy? The second one being, what is occupation? Because, and I don't want you to read this, there are loads of definitions out there in terms of what is occupation. And I'll just flick through some of these just to highlight some of the issues that come up, which again I think is useful in itself just to think about what does that mean for my understanding of occupation and what does it mean for the practice that I'm engaged in. So first of all, it is those ordinary and familiar things, okay? But then what does that mean about those extraordinary or unfamiliar things that we all do? Maybe not regularly, because otherwise they'd be ordinary familiar, but we do engage in things which are not ordinary and familiar. They're still occupations. Okay. One of the other things is that there's something about we have to do something. We engage, we are active when we are engaging in occupation. Okay. It's not something that just happens to us. We are participating in a very active sense, and we'll come on to talk about that soon. I think the other thing that is useful to think about, which isn't in all definitions, as you can see, is we engage in occupations individually, but also in groups. And that could be this is a group, it could be the Australian population who will all vote on September 14th. There's occupational aspects to all of those things. And sometimes I think when we don't always really acknowledge the group nature. But I suspect that varies from practice setting to practice setting as well. But much more broadly in terms of society and whole countries and all sorts of things. The other interesting thing is that they happen and they are defined within particular contexts. So what might be recognised as an occupation here, and I'm thinking about where we all are, in Queensland might not be quite the same as New Zealand or the UK, or on the Gold Coast might not be quite the same as Chinchilla. I don't even know where Miles is, but Miles or some of those other places. Oh, okay. Okay, it's out that way. There might be differences in the sorts of occupations that we engage in based on that geography and what's available and all those sorts of things as well. So we need to recognise the context in which occupation happens. And I'll come on to that. Yeah. So rather than try and come up with another definition of occupational therapy, my approach is to do what I've called the nature of occupation, which is a bit of a cop-out because it means I don't have to come up with a definition. But I actually think it's more useful because I'm suggesting, and this is based on a fairly extensive literature review, that these are the 5 components of occupation, that all occupations have these 5 things, and that for it to be an occupation, it has to have all of these 5 things. And therefore, these are the 5 things that we need to really understand and think about. And I'll go through each of them in turn, but relatively quickly. Okay. So first of all, occupation is active, and this is a fairly obvious one, but also a tricky one in some ways. We can all recognise, I think, regardless of where we are, where we work, that occupation is an active process, that it requires us to use our capacities and our abilities, and that can be everything from muscle strength, range of motion, concentration, planning, memory, all of those sorts of things. Like I said before, we have to participate and do something in order to engage in occupation, and that's the easy stuff. The thing that I think we don't often recognise is that occupation at some level also might seem not very active. I'll give you an example, because I think OTs often get caught up in you're not doing anything. We get stuck up on the doing. And that's why I think some of the literature that's come out in terms of doing, being and becoming and belonging is useful in reminding us that you don't have to be physically doing something to be engaged in occupation. So one quick example is, and apologies to those who've heard this, but it's a nice example, I think, is that there was a patient who was in a hospice. This is in the UK, and it's in Yorkshire, which is important because this was a man looking out the window at the countryside in Yorkshire, and that's all he did. That's all he did in inverted commas. He sat and looked out the window, and so the OT went and said, "What are you doing?" They tried the physio, the nurse went, and they tried everyone. And then the doctor ended up being bullied into going and saying, "Can you sort out Mr. Jones? He's sitting doing nothing. We're all really worried about him." So the doctor turns up and says, "We're all really worried about you, Mr. Jones. You're not doing anything." He got really angry and he said, "I wish you'd all bleeping leave me alone because I'm not sitting here doing nothing. I'm looking out the window, remembering about the walking trips my wife and I did. My wife died a few years ago, and so I'm sitting here remembering all of those good times as I'm approaching my death, essentially." And so I think it's worth remembering that occupation, we often think about the physical doing, but we need to recognise that all of that's a very legitimate occupation for that individual in that situation. So we need to think about that. So occupation is active. It's also purposeful, so we do it for a particular goal. And we often talk about self-care, productivity, leisure. They're all purposes and all goals, but that every occupation has a purpose. We do it for a particular, with an outcome in mind, one of the easier ones. Occupation also has some meaning, and this one's a bit trickier, I think, because meaning is a really dynamic thing, and that we could go around the room here and via video conference, and I could say, why are you here in terms of what's the meaning? And it could be a whole range of things, but we're essentially engaging in a similar occupation, probably isn't exactly the same because of those differences. But also, what might seem like the same occupation could have different meanings when it's done at different times or in different situations. So me cooking a meal for my parents does have very different meaning than me cooking a meal for me and the cat, because there's a whole range of things around that. So meaning is another one which is really important. And I think this is the one that sometimes, I think we vary in terms of how good we are at uncovering what meaning is, because it's actually really hard, because you've got to ask the why question, which we're all told not to ask. Why is that important? But I think you've got to keep asking the why question to get to the bottom of this sometimes. And again, I'll stop there. Second last one is that occupation is contextualized. And again, this one appears in all the models and frameworks. Occupations happen in a range of contexts. The easy ones are physical, social, those sorts of things, but also political, economic, a whole range of things as well. And we need to recognise that occupations are influenced by those environments or contexts, and that cartoon is one of them. If the context doesn't provide opportunities, that will have an impact on the occupations available to some people in that situation. Whereas if you were around the corner, that's another sort of opportunity, but that might shape the occupational patterns or behaviour of somebody. Crime. Oh, okay. It's opportunity which is blocked up, or crime which is open. So it can go that way, but also we need to recognise that by engaging in occupations, we can influence, and we do influence, the contexts. And the really concrete example is all the buildings that we exist within. We have changed the physical environment to enable us to exist in this world, in a sense. Okay? But also the way the way everyone's behaving now is impacting on the social environment here. There's nobody having conversations or on the telephone having loud conversations. We're recognising that there is a particular context we're in that requires particular ways of being, and everyone so far is abiding by those. Okay? So we need to recognise that. And the final one is that occupation influences health. And interestingly, if you look at the literature, this one isn't spelt out very often, although there is research about this. But if you look at the definitions, lots of them don't include this. But it's actually the fundamental. It's the fundamental relationship in terms of occupation that occupational therapists are concerned about. And the slide is deliberate because we often think about the good health, the positive health impacts of occupation, but depending on where people are working, but also if we maybe reflect on our personal lives, which I won't get you to share, people do engage in occupations or things that we could argue are occupation that have a negative impact on their health. And I'm sure some people have lots of examples from clinical practice about that. So there is a relationship between occupation and health. We often assume and focus on the positive, but we need to not forget that there can be a negative relationship with that as well. So that's the nature of occupation as I've seen it in the literature. And like I said before, and all occupations have all of those things. And this is a really crude example of it can vary. So one occupation might have more of one or less of the other, but actually they all have all of them. And the example I often give is cleaning the toilet. People would often think that cleaning the toilet probably doesn't have much meaning for somebody, but it has some meaning. Otherwise, why are you doing it? And we won't talk about that. But it does have some meaning. And the other challenge I often give students, because I often get students to fill out a weekly diary of occupations, and get them to think of something they've done during the previous week that didn't have all of those things. And actually it's very hard because by definition, if you've done it, it's an occupation, and therefore it has all of those things. And we can think of examples, or you can think of situations where people might not have some of those, but actually then I think we get into the realm of, well, is that occupational deprivation or occupational alienation where people are doing things that don't have meaning and all those sorts of things. But if we think about our lives and the lives of our clients generally, all occupations have all of those things.
To varying degrees,
yes.
like something could be more active for one person.
Yes. Yeah.
No, but I mean the same occupation.
That's right.
Cleaning the toilet could have more meaning.
That's right. Exactly. Exactly. And that's a good thing to think about. Again, if you've got students where you're bored tonight on a Friday night, you sit around with a few people, you can talk about why do you cook a meal for the family, why do you do it, and you will find differences on that. So again, it looks similar or the same, but actually it's slightly different for different reasons across people as well as within people. Okay, so that's the nature of occupation. I think the thing that I haven't got time to do, but I think is one of the things we could do later on, but I would encourage you to do if you can't do it already, is there is some evidence out there that supports all of this. So if you remember, occupational therapy was founded on a belief that these things, that this was the case. There is some evidence out there that shows humans do have an occupational nature. There is something about engaging in things that are purposeful, meaningful, active, contextualized, blah, blah, blah. That is unique, that is human, maybe not uniquely, that's a whole other discussion. So there is evidence for that, and there is evidence that there is a relationship between engaging in occupation or not engaging in occupation and health. So there is that out there. And I think one of the things, so I think that's sort of the second level then in terms of, as occupational therapists, we need to be able to talk about occupation at this level and probably even deeper, I think, but also have the evidence to support that, because I think that's what helps in practice, particularly in the evidence-based practice world we live in. So that's occupation. So what in terms? So what does that mean for us or for you? And I think it goes back to it's this idea that I think we should be in this paradigm of occupation, and if we are thinking that that's what occupation is, how does that make us see the world differently in terms of the issues around us? For example, those awful things that are happening in America the other day and today, as well as shootings today. What are the occupational risk factors, if you like, that are leading some people to engage in that sort of stuff? Because there are occupational, well, I would suggest there are occupational issues, not just occupational. So it shapes the way that we see the world. I just want to give you one quick example before we might come to an end. From my PhD research, I did some research with men living with HIV. This is the traditional biomedical view of progression with HIV. So you're not infected, you are infected but asymptomatic, you're infected, symptomatic, you develop AIDS, and then you're dead and you've left people behind. That's the traditional route through, well, that's the biomedical view. I interviewed men with HIV and did their life histories and spent one of the men's histories took 16 hours, so we're talking fairly in-depth analysis of these people's lives. And what I was looking for was there is some literature in OT that says when people are faced with life-threatening, chronic, challenging conditions, they might let go of old occupations, they might develop new occupations, or they might do occupations slightly differently because of their changed situation. That seemed to make sense to me. What I found, without going into too much detail, is that actually neither of those were quite right. And that if there was one man there were a few, but there was one man in particular, and he monitored, and you can identify the stages of the progression of his HIV through the changes in his occupational pattern and occupations. So he first recognised it when he was going for a run, and then there are other things, and then in terms of his recovery, that was about his running as well. So running and fishing for this man, they were the two occupations that were almost the indicators of his health. So he wasn't interested in his T4 cells and all those sorts of things. For him, it was about the occupations he couldn't do, the way he did them, what he got out of them, all those sorts of things.
Occupational markers.
Yes, well, that's. I think that's what my thesis has in it: occupational markers of HIV. So yes. So just a little taste of the thing that I'm really keen on is really start to think about how does this make us see the world differently? Because I think we too often get caught up in, most of us work in biomedical frameworks and situations, and we try and fit these things together, and you can do that to a point, but I think there is some value in sort of allowing us to recognise that we think differently, and that let's do what we can with that, just in the situations we work in, because I think if we try and go the other way, we're doing ourselves out of the sort of skill and expertise that we have. In terms of so what, that's, I guess, in terms of what, that's where I wanted to open up for discussion, and I'll turn the slides off in a second. And I'm happy to take questions about any of the content, but I'd be really curious to think about what are some of the things this has got you thinking about. Depending on where you're working, practice might be the key one you want to talk about, which is fine as well. In terms of education, that's at the forefront of my mind, because I'm thinking as I design the program for Griffith, what does this way of seeing the world mean in terms of how should this program be developed? Should we have courses which are about physical, mental health peds? Should we have courses which are neuro, which blah, blah, blah? Should we have children, adults, older people? And we're not going to have any of those as an aside, but I don't want to get into that detail. Because that's that stuff if it makes us see the world differently. Okay? So what I might do is, again, if it's all working, is stop that so we can all see each other again, and ask if there's any questions or comments.